Ultrasound reporting. Legal disclaimer. Information is for general and educational purposes only. Content is not nor intended to be a substitute for professional, legal, or clinical advice. While we strive to make the information as timely and accurate as possible, we make no claims, promises, or guarantees about the accuracy, completeness, or adequacy of the information contained, and expressly disclaim liability for errors and omissions. Course objectives. At the conclusion of this session, participants will be able to verbalize the importance of ultrasound reporting. You'll be able to verbalize what ultrasound reporting is, the key components of ultrasound reporting, verbalize structured reporting in ultrasound, the communication of findings to patients and the healthcare team, and you'll be able to verbalize the ALARA principle, which is as long as reasonably achievable. The topic is important because ultrasound reporting is an important topic due to several critical aspects. Management of patient care. Reports serve as a basis for decision-making regarding treatment plans, follow-ups, and referrals to other specialists. Legal implications are reports form part of the permanent record held in the patient's notes and are therefore of medical legal importance. Efficiency and effectiveness. Well-structured reports can lead to faster and more informed decisions, improving workflow within the healthcare system. Enhanced communication. Clear and concise reports aid understanding among various stakeholders, including referring physicians, patients, and other members of the healthcare team. Research opportunities. Standardized reports allow for better data analysis and comparison across institutions, contributing to ongoing research efforts. Safety. Following the ALARA principle ensures that ultrasound procedures minimize any potential harm to patients while maximizing diagnostic utility. Effective ultrasound reporting contributes significantly to high-quality patient care and promotes continuous improvement within the field of medical imaging. What is an ultrasound report? Clinical opinion and provides a specialist interpretation of images. Essential for the management of the patient that ultrasound practitioners produce reports based on their examinations. Ideally, all reports should attempt to answer the original clinical question, and they should be accurate and informative. There is no single correct way to report, but important elements include a concise, logical structure, clarity, accuracy, and an attempt to answer the clinical question with differential diagnosis if appropriate and suggestions for further management. Converting medical and scientific information requires a particular style which can be learned. Standardization improves clarification, makes data retrieval from reports easier, and so facilitates audit and research. Reports should contain information that can facilitate audit, teaching, and research if these data are easily extractable. Findings that need to be acted upon urgently should be communicated. The report should be signed by the radiologist and sent to the referring clinician, who will then discuss the results with the patient. The report should contain the type of exam, history, reason for the exam, technique, findings, and recommendations for follow-up actions. Key components of ultrasound report. Key components of an ultrasound report include type of exam, clearly state the type of ultrasound exam conducted, patient information, include patient details like name, date of birth, and date of the exam, technique, describe the technique using the examination, findings, present findings in a structured manner, starting with normal or abnormal observations for each organ or area examined. Recommendations. Further recommendations for further actions or follow-up. Conclusion. Summarize the most relevant findings and their interpretation clearly and concisely. Measurements include relevant measurements with normal ranges and important values in both tables and text body of the report. Images. Incorporate images to enhance communication and provide visual representations of findings. These components help ensure that the report is informative, accurate, and useful for patient management, audit, teaching, and research purposes. Structured reporting for ultrasounds. Structured reporting in ultrasound refers to the use of an IT-based means of importing and arranging medical content in the ultrasound report. Structured reporting can add value throughout the imaging chain, including improved efficiency, accuracy, and clarity of reports, improved communication with referring providers and patients, and enhanced patient care through improved adherence to guidelines and local best practices. Standardization improves clarification, makes data retrieval from reports easier, and facilitates audit and research. Key elements of a structured ultrasound report include a concise, logical structure, clarity, accuracy, and an attempt to answer the clinical question, with differential diagnosis if appropriate, and suggestions for further management. The report should contain information that can facilitate audit, teaching, and research if these data are easily extractable. Structured reporting can unleash the power of data to support clinician collaboration, patient health, business efficiency, AI tools, and even clinical research. Communication of findings to patients and healthcare teams. Communication of findings to patients and healthcare teams is an essential part of the ultrasound process. The sonographer is the most expert to point out the findings on the images and talk about what they mean. There are different approaches to informing patients of their results, including not telling, always telling, and asking to tell. However, it is generally recommended that sonographers inform patients of normal results to alleviate unwarranted anxiety. When the findings are uncertain, sonographers can tell the patient that there are many images to interpret and that they want to go over them carefully to make sure not to miss anything. If patients still want to know, however, they have the right to wait or to receive a phone call once more definitive conclusions have been reached. The report is the primary means of communication between the ultrasound department and the referring clinician, and it should be accurate and informative. Key components of an ultrasound report include the type of exam, patient information, technique, findings, recommendations, conclusion, measurements, and images. Structured reporting of ultrasound examinations can add value throughout the imaging chain, including improved efficiency, accuracy and clarity of reports, improved communication with referring providers and patients, and enhanced patient care through improved adherence to guidelines and local best practices. So in conclusion, ultrasound reporting is a crucial aspect of medical imaging that plays a significant role in patient care, communication, and quality assurance. A good ultrasound report should have a concise, logical structure, clarity and accuracy, and address the clinical question with differential diagnosis and recommendations for further management. Key components of an ultrasound report include the type of exam, patient information, technique, findings, recommendations, conclusion, measurements, and images. Structured reporting in ultrasound enhances efficiency, accuracy, and clarity of reports while improving communication with referring providers and patients. Effective communication of findings to patients and healthcare teams is vital for informed decision-making and patient care coordination. Overall, ultrasound reporting. Structured reporting practices, adherence to the ALARA principle, and effective communication of findings are integral components in ensuring high-quality patient care and promoting best practices in medical imaging.